Now I am going to show you the features of the left kidney. As you see here, this is the left kidney. I am holding it in the left hand in such a way that the upper pole should be closer to the midline and the lower pole should be away from the midline. So this is the left kidney. So upper pole, lower pole, but these two will not help us to decide the side. The main important structure which will help us to determine the side is the structures in the hilum. As you see here, anteriorly renal vein, then next to that renal artery, then most behind ureter. So renal vein, renal artery and ureter, these are the three important structures which are arranged from anterior to posterior in that particular order: vein, artery and ureter. So these three are the structures which will help us to determine the side. Now I am holding the left kidney in anatomical position. So it occupies four regions, namely the epigastrium, umbilical, left lumbar and left hypochondriac. Four regions it occupies. It is having an upper pole, it is having a lower pole, it is having a medial border, it is having a lateral border. The medial border is convex above and below, and in the center it represents a depression called hilum. So in the hilum, these are the three important structures which will help us to determine the side. Anteriorly the renal vein, in the middle renal artery, posteriorly the pelvis of the ureter. So please remember this order. This is the only key point which helps you to determine the side of the kidney. Then it is having two surfaces, anterior surface and posterior surface. Now if you see the relations of the anterior surface, so as this is the left kidney, it has 6 relations anteriorly from above onwards. So this area is for suprarenal gland, left suprarenal gland. Just immediately below that will be the gastric impression, immediately below that will be the gastric impression, and immediately below that will be the pancreatic impression, Just below that pancreatic impression will be the jejunal impression. Lateral to the jejunal impression will be the colic impression, and just lateral to gastric impression will be the splenic impression. There are 3 impressions which are peritoneal, namely gastric, then splenic and then jejunal. So gastric, splenic, then jejunal. These 3 are peritoneal relations, whereas suprarenal, pancreatic and colic, these 3 are non-peritoneal relations. And same thing if I look into the posterior aspect. So when I change it, so this will be the medial and this will be the lateral. So posterior relations will be divided into upper half and lower half. In the upper half, if you see, it will be related to, as it is left kidney, it is located somewhat higher, so it is related to 11th and 12th ribs, 11th and 12th ribs, and also to the left diaphragm, okay, and also to the left side of the diaphragm, and also left costodiaphragmatic recess of the pleura. So 11th and 12th ribs, left half of the diaphragm and left costodiaphragmatic recess of the pleura. And the lower half will be related to 3 muscles from medial to lateral side: psoas major, quadratus lumborum and then the transversus abdominis. And these muscles will be covered by the respective fascia. Psoas major will be covered by the iliopsoas fascia, quadratus lumborum will be covered by the anterior layer of thoracolumbar fascia, and transversus abdominis will be covered by the fascia transversalis. Between quadratus lumborum and the anterior layer of thoracolumbar fascia, there will be 3 important structures, namely subcostal vessels and nerve, iliohypogastric nerve and ilioinguinal nerve. So these are the relations of the posterior surface. And if you see the vascular segments of the kidney, so renal artery will be divided into an anterior division and posterior division. Anterior division will divide into 4 branches which supplies the apical, upper, middle and lower, whereas posterior division supplies only the posterior segment. So between the segments supplied by the anterior and posterior division, there will be a vascular plane along the lateral border, just close to the lateral border, that is called as Brodel's line. So this is the line which is prepared by surgeons to remove the calculi in the cortex. Thank you.